Welcome to the office.
Reza,
Hey,
nice to meet you.
Nice to
Welcome
meet
to
you
the
too.
office.
thank you so much.
How can I help you?
Oh, well, almost 2 years ago, I did something very stupid. I asked someone to walk on my back. I had some spasms. That person lost his balance on my C7 and T1, okay?
Okay.
And it was like it was not like a compressive force, okay? It was like a shear force. And then I heard something. It wasn't a crack.
Okay.
It was different.
Okay.
Something coming out of my joints. And immediately after that, I couldn't breathe. And then I had bradycardia. My heartbeat was around 30. I went to emergency room 6 times in 2 weeks.
Okay.
I couldn't breathe for 3 months. I was on the ground, lying on the ground, trying to survive.
This is back home in Tehran.
Yes.
So you had these things after someone was stepping on your back. You started to get all these symptoms from pain and bradycardia, shortness of breath, all this stuff. I think when I explain what I see here, I think it's going to make a lot of sense, number one. Number two, whatever happened 2 years ago was not the cause, but was a trigger.
Exactly.
It was a trigger of a process that was already happening in your body, and it'll make sense. Your blessing was the fact that you're a strength and conditioning coach. Your blessing is that you've been training and active all these years. If you weren't, you'd be very miserable.
Mm-hmm.
Okay? You already know that.
Yeah,
If you don't work out for a period of time, I know you don't feel so good, do you?
yeah, it's been like 3 years.
Okay.
Almost. Because first year I didn't go to gym because
No
of
gym, no weight training?
No, not.
How about now, activities, what do you do?
Well, I do some rehab exercises
Okay.
for myself, like external rotation and stuff.
Some band work you're doing? Okay. Walking, swimming, biking?
I don't swim, I don't bike, but I walk a lot.
Perfect. Okay, so that's going to be your homework with me,
Mhm.
walking, hiking. Okay? No weights for right now. We're going to go through your full spine x-rays. I'll tell you everything that I see. We'll examine you. We'll figure out where we're going to start today. We'll see you for a few visits, and then we'll figure out a game plan.
Okay.
Okay? You ready?
Yeah, let's do it.
Let's do it. So we can see quite a few things going on here, sir. Number one, we can see that we have a short leg on the right side. This short leg on the right side is causing this curvature issue here.
Mm-hmm.
Okay, so I don't like to use the word scoliosis loosely. This is a curved spine from a short leg. Does that make sense?
Yeah.
Okay. So we have a curved spine from a short leg. The good news is this. I can see through your SI joint here on the left side, okay? It's binding a tiny bit here because there's a tilting of the sacrum. You can see the whitening or enuberation of the ilia side of the SI joint on the right side. And that's happening because that's scar tissue or inflammation because you've been favoring which side? The right side.
I said almost.
Right? And you can see when we're looking at the, dude, you played hard, dude. You played hard. You played like you're rough. You played rough. The issue is this, Reza. We have a 14 millimeter leg length discrepancy on the right side. We have a rotated sacrum on the right side with a 3 millimeter drop. So what does that tell us? We had a tailbone injury. Okay? We have a pelvic misalignment on the left side which came later. And the reason I know that is this. The measured difference is 14. If I correct your pelvis first, it's going to make your hip worse. Acetabulum, you can see because of the uneven weight distribution, you can see that the right side, you don't have a smooth symmetrical joint space there. On the left side has been compensating, so what's happening on the left? You're getting a little bit of this calcification of some of the ligaments. So your body is going through a lot of compensation right now, dude. Your tailbone injury is starting right around S3, S4, right there. Right there. For your case, we have sacrum on the right. Drop 3, that's where we're going to start. Okay? Digestion-wise, your Megan Blasi is fantastic. You have a good Megan Blasi there. That is good. You do still have here a lot of undigested food in the ascending colon, a little bit in the descending. I don't know if that's your travel or what, but the good news is your Megan Blasi is good. Makes life easier. Second thing I'm seeing here, flailing of the ribs. This is calcification at the ends of the ribs. When I see this, the first thing I tell the patient to do is get the thyroid checked. There's an imbalance in your calcium phosphorus regulation. We need to rule out thyroid first and parathyroid. If it is off for any reason, we need to address that. Now, you said there is a little bit something here. You see this nice kink in here, right? T1 to T4, this is heart and lung. T5, liver, gallbladder, digestion, stomach, pancreas. Now let's change the contrast to see if there's anything hiding there, okay? And T1, T2, T3, T4. You said you had a vertebral body fracture at T4, correct?
Yes.
And do you have that report by any chance? And when
No, it wasn't in the report, but I showed it to 3 spine surgeons, and they all told me the same thing.
And do you know where it is?
They told me on the left side, the wedge of the vertebra.
Here?
Yeah, left side. But it's been 2 years, so maybe.
Yeah. The problem is this, okay? I see there's something going on right here. The issue is this. With that type of curvature, that doesn't heal the way it's supposed to, right? It's going to heal a little bit off. And the question is, do you have pain in the ribs?
Oh my God.
Left side or right side?
Left side.
Left side. Okay.
It's killing me. Like.
Yeah. Your jaw deviation. Your left goes off, your right severely compensates. You have a right swollen atlas. C1 right here.
Here, yeah.
On the right side. You have a C2 wedged on the left. You have a critical atlas. And on the lateral film, what we want to see is what? We're looking at the posture. We're looking at the tailbone. And remember I said we had tailbone injury. And there it is. And this should be a smooth arc. You have 1, 2, 3.
And then.
So you had 3 tailbone injuries. You have a base posterior sacrum is what it's called. And it's rotated, we said, on the right side, remember?
Mm-hmm.
Okay. So we'll probably be starting down low, S2, S3 somewhere. Once we get that sorted, then we got to deal with the rotation. Once the rotation is sorted, then we can figure out the rest up top, okay? Here's the interesting part. Okay. On his lateral film, so if we look on his AP film, yeah, he's got curvature, he's got a short leg, his pelvis looks out of balance, all that looks kind of a lot. But when we look at your lateral film, your body has held well because you maintained your spinal sagittal curves. That's why you've been able to maintain yourself. Okay? So I'm impressed with your curvature here. I didn't expect this part to be lined up like that. If we look at your discs overall, your discs are good, 5. But here's what I want you to see. 5 has a little opening or a Schmorl's node. 4 is tilted. 3 is tilted. 2. These are all tilted, right? So if they're all tilted, what does it tell us? The answer is not coming from there. The answer is coming from down low. Now, as we go up to the neck, you have a good curve here. Something is going on around C3 though. And let's just see on the flexion extension. This is extension. You don't have a lot of extension in your neck. Here's the thing that happens to you in flexion. Your whole spine should move forward. You're only moving up top here. And I want you to see, this is the culprit right here. Yeah. This is still binding here. Do you see how these are still together? This one opened up.
This is C7?
This is 2, 3, 4, 5, C6.
6 and 7.
So I see 6 and 7. I see the sacrum, sacrum first. And in terms of, you were saying your T4, there's nothing for me to do for that T4, okay? There's nothing for me to do. If there's a vertebral bone fracture, you leave it and let it heal. And it's already healed, by the way.
Yeah.
So there's nothing for me to do there. All right? So let's get started. First thing we want to do is let's evaluate and get an overall appearance. And what are some of the things we can see? Right pelvis is down, left side is up. Right scapula is down, left shoulder is up. Okay, as we get to here, so what he's kind of complaining is this curvature here. And I'm going to dispel what he thinks it actually is because it's not what you're saying it is. I'm going to explain it on the exam, okay? Now, if we see the right side is compensating, short hip on the right, ear is higher on the left in order to compensate for the short hip. Otherwise, you'd be like this, right? Okay. Go ahead and walk towards, watch the dimples, walk towards the corner. And you're going to do this several times, please. Any knee issues? Good.
No.
He got a little Tehran wiggle. And it's very subtle on him. And the reason it's subtle is he's a trainer. He's been working out a lot.
Used to, actually.
So your dimples move this way instead of up and down. They move side to side this way. And that short leg, you get a little kink on the right side.
Like this.
So it goes like this and like that. Go ahead and walk this. And it's very subtle, but the main thing is this. You're not getting movement through your SI joints. Okay? Right leg pronates out and you get a lot of wear and tear on the back right heel because of that short leg. Have a seat please here. Starting at the base. And the first thing we're getting, oh wow, interesting. Okay, so we're starting at the base. It looks like it's going to be at C6, C7. It's not. Oh, it's starting up top here. C1. 9, 10, 9 points up top. Oh, you got a lot of compensation. So, starting at the neck going down, it looks like it's going to break here at T5, T6. Nope, keeps going. Looked like it was going to stop. It didn't. It went past 0, comes back, goes right there. That's around 5 points. Nope, and now it switched again. You see that, Shasha? Switched again. So what is this telling us? It's telling us compensation. There it is. Gotcha. S3, penthouse. I'm not getting anything here right now. I'm getting this. And that, meaning it's not doing this and stopping at 0. It keeps fluttering around, so there's a lot of compensation. I thought I got a break here, then I thought I got a break here. So that's also compensation. We're going to focus on the basement and the penthouse today. Okay, sir? Scoot forward, please. Feet together. Feet together, and let's check movement. Feet touching. Open and close your knees. Open and close. Feet are touching. Right side only. Okay, when he does the right, left is okay. There's a little bit of movement at the end range. Do the left side, please. So when he does this, this thing drops down on the right. Do the right side again, please. Good. Do the left side, please. Yeah, so when he does the left, this whole thing is pulling from the T12 rib all the way down is pulling when you move this left side. Okay. Now, static palpation, head down, please. And I'm sure something will show up here later. When we're just looking at it, you can see the bumps here. Then he has dishing, it disappears. All this you can't see. All of this disappears, and then it starts up again here. So you can't see any of your vertebrae. All this is compensation. Now here you can see the swelling and edema. Starts to pull all the way down. Good. More tender when I push here or here?
Actually, I'll do it.
Let's try this. L5, come back towards me. All the way back, sir. 5. S1. S2.
Here.
S3.
Yes. Oh shit.
S5 or S4?
Here.
S4. Do you feel that little,
Yeah.
that step? S4, let's check up top. Sit back for me, please. So we have the base here, T1, C7, C6, C5, C4, C3, C2. C2 is wedged on the left, C1 is wedged on the right.
What do we do?
We're going to start C2 in the chair, critical atlas and S4. Okay? All right, you ready to get started?
Yeah.
Scoot to the right, please. So what we're going to do, as we said, we're going to do the critical atlas, and your critical atlas, you have the atlas wedged on the right, but we have C2 on the left. So let's start with C2. C2, hands on your lap, please. Good. There you go. Try not to help, okay? Look up. Gotcha. Nice. Right hand up now. Now I'm taking the stabilization opposite for his atlas. C1, we're going to set it as an ASRP, so it's come this way, right. I need to turn the head away this way and set through, okay? Down, RP, so turn away. Gotcha. Nice.
That was so precise. I felt it.
Yalla, walk. Imshi. Now for his sacrum, we said we're doing a PR sacrum, P7-R. Now, ideally for a rotated sacrum, you should be, if it's a high-low adjustment of a rotated sacrum, you should be on the opposite side of the rotation. It's on the right, you're on the left. And so you're bringing the sacrum to you. We need to torque this up on the right side, this way. So his challenge is I need to be on the right side of the sacrum. I need to torque up, but I need to bring it in towards me. That's a piece, brother. You okay?
Yep. Gotcha. So fast.
Gotcha. So, sacrum, rotation, pisiform contact. Now let me do the work. Try not to help. Relax there. Good. Gotcha. Come on up. Walk it out when you're ready. Your dimples are moving up and down better now. Keep going. Cool. Back over here. Have a seat, please. Starting at the base of the neck. Neck is clear. This one is still here though. 5 points are on L1, L2. Sacrum is clear. Let's check. I don't want to do this one so close to that on your first visit. Just want you to walk a lot. Let's make sure. Back slowly towards me. This is 5. This is 1. This is 2. A little different.
Yeah.
3.
Much better. Yeah.
4.
I don't even feel it.
3.
Like 80% better.
5, 4, 3, 2, 1.
Yeah, here.
1 is tender,
Yes.
or 2 is tender?
Both of them actually.
2 or 3? 2.
Yeah.
Raise your right leg. Raise your left leg. Ears.
Yeah. Good.
Shoulders. Let me do it. There you go. Nada. Now you get a buff and polish. Squeeze. Relax. You don't have to hurt me. You don't have to show me the strength. Just squeeze. Squeeze. That's it. Squeeze. Nada. There. Squeeze. Relax there. There you go. See, it works better. You want your nose job today or next time?
Maybe next time. Ouch.
5 times fast. 1, 2, 3, 4, 5. Squeeze. Good. Squeeze. Homework. 10,000 to 15,000 steps of walking. Ice the areas that I adjusted. Okay. 4 or 5 liters of water a day. Just a gallon. Welcome to the office.
Thank you so much for having me.
You're welcome.
It was great.
Welcome back, sir.
Thank
Reza, how are you?
much. Perfect.
Okay, so how did you do with your first adjustment?
Well,
What kind of changes did we get? Anything good?
yes, a lot of things actually.
Okay.
You know, remember we talked about this story, that everyone has a story, and most of the times it's not the right one.
Yeah.
So I was trying to reevaluate everything, especially when I was going for a walk, and it all came together for me. And one of the biggest differences, my breathing got so much better.
Okay.
Not the first day, but yesterday and today. Especially.
Meaning you're taking a deeper breath in?
Yes, and I don't have this spasm in my bronchi or diaphragm anymore.
And you had that for how long?
2 years.
Okay, so breathing is better?
Yeah, breathing is better, and still remember, we're not chasing the symptoms, but
Yeah.
just so you know.
How is this?
Yeah, I don't have the spasms anymore. Yeah, on my levator and around my thoracic spine.
How do you feel about that?
Oh my God, such a...
No, how do you feel about it that we didn't chase it? Good.
All right.
So that's a good start for us.
Yeah.
Good? Okay. Shall we continue?
Yeah, of course.
We're going to continue on. Third cervical, 15 points. Things are shifting quite a bit for this guy. Wow.
For better or worse?
It's pretty impressive,
Oh,
actually.
okay, good.
Dude, I got a 3-4 pointer in your tailbone. The big one is in your neck today. This is clear today.
Okay, perfect.
Right hand up, please. And down. Ugh. C3. Good. Look up. It's a baby one. You're helping. Stop helping so much, please. Mm-hmm. Boom. Boom. There you go. Nice. Like butter, baby.
Fireballs.
Walk it out. Left side down, and let's get the sacrum. We're going to do the right rotated sacrum. Ready to shut you down. Da-na-na-na. Up on your shoulder. There we go. You see the difference there? When you're up on your shoulder, we can roll you more as a unit. When you're not up on the shoulder, guess what happens? It's more twisting. Okay? Let it roll. Gotcha. Like butter, baby. Oh! Walk it out. So we got something to compare to. Let's walk it off, please. You're all settled into your place now? Good? Got your food situation sorted out?
Yes.
You eat home food?
Always.
Always?
Always.
You make or you?
Yeah, I cook myself.
Oh, nice. Let's run the meter on the back and let's see what's going on. Starting at the base. We had a big one at C3, didn't we? No mas. Clear. Little flutter in the middle. How's your walking?
Better.
Meaning you're doing your 10, 12, 15,000 steps, yeah?
Around 1 hour a day.
Beautiful. After this week, next week, you do 1.5.
Sure.
Just split it up throughout the day.
Yeah, sure.
All clear, brother.
Good?
Yep. On your back, please. Raise your right leg. And relax the foot. Relax the left leg up. Sit. Oh, you get your nose up today. Head down. Right there. Easy peasy. That's it. Kalas. Bas. Breathe in. And out. That's it. Come on up. I want you to steam for the next week, okay? Boil a pot of water. Cover yourself with a sheet. Let everything kind of drain out. You do have a lot of congestion up there. Let it drain out.
Just be careful, I don't want to hurt you, okay?
I appreciate it. Thank you. Thank you.
Oh, yeah, I know. What you can do.
Stories. Stories. We all got stories. Come close. Squeeze. Squeeze. Beautiful.
Good. Thank you.
We're all set, okay?
Good.
Enjoy your weekend.
Thanks.